Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
There's an old dental axiom that you should visit your dentist every 6 months for a checkup and to have your teeth cleaned. The dental hygienist is usually the person who cleans your teeth. Have you ever realized that the hygienist does a great deal more than just cleaning teeth? During this presentation, we are going to explain the responsibilities the hygienist has in helping patients prevent oral disease. First, and most obvious to all of us, the dental hygienist cleans our teeth. Cleaning the teeth involves removing both hard and soft deposits from the tooth surfaces through scaling, root planing, and polishing. During this procedure, the hygienist will perform an extraoral and intraoral examination, checking for conditions of health and disease. As a member of a health care delivery team, the hygienist must do many involved procedures which require highly developed manual dexterity. These procedures include topical fluoride treatment and the application of sealants to decrease the occurrence of decay, charting of the oral cavity, taking impressions for steady casts, and the taking of radiographs to aid in diagnosis and treatment planning. Another procedure is the polishing and contouring of amalgam restorations to provide a smooth surface which will reduce the possibility of gum irritation and recurrent decay. In providing this aspect of oral health care, we can see that the hygienist must be qualified as a dental clinician. A service of extreme importance to the patient and performed by the dental hygienist is patient education. The hygienist must provide the patient with a knowledge and understanding of the causes of dental disease. Then the hygienist must help the patient develop the skills and desire necessary to achieve and maintain a high level of oral health. This will include instruction in an effective and safe method of flossing and toothbrushing for complete plaque removal at home. This may sound a bit simplistic, but there are many different methods of brushing and different devices for home care that the hygienist must understand in order to teach the patient the technique which is best. Brushing and flossing require manual skills which take time and practice to become proficient at. So the hygienist must work with the patient in perfecting these skills.
Can you notice the red that's clinging to the teeth? Mm-hmm. Okay, that's plaque. You want to check the back teeth as well as the front teeth again, the inside surfaces, the outside surfaces, and the chewing surfaces. We're just going to move the brush in small, circular, overlapping, sliding strokes.
In providing this aspect of oral health care, we can see that the hygienist must be qualified as a teacher. The level of one's oral health can be affected by nutrition and eating habits. Maintaining oral health requires more than just avoiding sweets and brushing after meals. It is the hygienist's responsibility to provide the patient with the information necessary for this. Eating habits are related to many factors such as age, sex, geographical location, economic status, religion, family traditions, advertising, and more. So it is a challenge to the hygienist to be able to guide the patient in making practical and acceptable modification to the individual's diet.
Okay, now I'd like to talk to you about the dietary record that I want you to keep for the next 5 days. And what I want you to do is write down everything you eat for the next 5 days, including a weekend, and that includes breakfast, lunch, dinner, and snacks, and gum, if you chew gum. And then on your subsequent visit, we will evaluate what you have eaten and how it pertains to your oral health.
In providing this aspect of oral health care, we can see that the hygienist must be qualified as an advisor. The dental hygienist will provide some or all of these services for the people seen in the dental office. Children, teenagers, adults, no matter what age, need the services a dental hygienist provides. Hygienists also find challenging opportunities in public health, research, and teaching. Dental hygienists working in the field of public health function more as educators than as clinicians. They work in public schools providing health education or in local and state health departments as consultants. In this capacity, they develop visual aids such as movies, pamphlets, and other health education materials. They also speak to community groups such as expectant parent classes and are involved with well baby clinics and Head Start programs. There are also opportunities in public health that combine both the clinical skills and educational skills of the hygienist. Positions of this type are most often found in hospitals, state homes, convalescent and nursing facilities. The field of dental research is constantly expanding, and the dental hygienist with an educational background in basic dental and clinical sciences is a valuable member of the dental health research team. Hygienists are engaged in research in a variety of settings, such as dental and dental hygiene schools, hospitals, industry, and public health departments. As researchers, hygienists provide specialized patient care, perform laboratory procedures, and compile data. In an expanding profession like dental hygiene, there's always a need for qualified teachers. Dental hygiene programs are located in community colleges and universities. Responsibilities include classroom and clinical teaching and administrative components.
Okay, try using just a bit more pressure so that the edge of the cup does go into the interproximal surface.
Oh, I can see that that does go in a little bit
Yes,
further
you're
than
doing
what I
much-
was doing.
Much better on those areas that you had missed. That's good. I think you have it now.
A career in dental hygiene provides many opportunities for full and part-time work. It allows for a combination of responsibilities such as private practice and teaching or teaching and research. We asked a practicing hygienist for her viewpoint on dental hygiene.
I have found dental hygiene to be a very worthwhile profession for me personally, for many reasons. I have been working as a dental hygienist for the past 7 years, 5 years of which were spent in a private dental practice, a specialized periodontal practice, and I found that I very much enjoyed working in this particular practice because of the contact with the patients that I had. I felt that my training and my education, most of it started here because of the specialized area. Dental hygiene allows me to pretty much run my own show. I am able to see a number of patients each day, and in doing this, I have full control as to just what kind of progress an individual will make. The one factor that I found to be most amazing to me in dental hygiene is that most often a patient's first contact with any dental personnel has to do with the dental hygienist. And very often I would explain to individuals about preventive dentistry, which is something they thought was a very new concept. I have had many professional people look at me in amazement when I was explaining to them all about plaque control and these very common names in dentistry. And in a very small way, I feel very important being able to explain to individuals a science that many of them know nothing about. The dental society, as it is today, is practicing more prevention and hopes to have the dental auxiliary promote this in their everyday practices. And I find it's very, very satisfying to be helping individuals, not only dentally, but also in a pretty much a health program. Dental hygiene, not only in the aspect of working with people, is a very beneficial profession. I find that I'm able to have a lot of mobility, a lot of flexibility with my work. Not only do I work in a private practice, that helps me maintain my my skills, but I also am able to teach part-time, which on the other hand enables me to apply the experience that I have gained through my years of practice and show others the techniques that I've learned, and it enables them to be able to find a profession that I think many girls are finding to be a pretty worthwhile occupation. The monetary aspect of dental hygiene has proven to be very, very worthwhile also. There's no problem with finding a job. I've lived in 3 states and worked in different offices and have never really had a problem finding employment. It all depends on what area you work in and what part of the country, but if you're very ambitious and you want to really work at something, you could make very easily close to $20,000 a year, if that's something you're interested in. But I have found, all in all, dental hygiene is a very looked up to profession. The dental practice cannot manage without us, and the way things are going today with the companies promoting all kinds of dental benefits and allowing more work to be done, a dental hygienist will be very much in demand now and in the future.
We have demonstrated the many and varied responsibilities of the dental hygienist. We have discovered that a hygienist must be willing to interact with patients as a clinician, educator, and advisor to help patients prevent oral disease.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.